Perform hand hygiene and observe other appropriate infection prevention procedures. Prepare the equipment needed in assessing. Provide for clients' privacy. Good morning, sir. I'm your nurse student, Tristan Julie Borga Martin. So, may I know your name?
My name is Harold Rayvin.
May I know your age?
I'm 16 years old.
And where do you live? So, what I'm going to do is I'm going to assess your mental status, your skin, your nails, your hair, and your skull and face. And what I need you to do is your cooperance so that I can perform my assessing well. So in doing so, you can know your general health status. Observe for signs of distress in posture or facial expression. Observe body build, height, and weight in relation to the client's age, lifestyle, and health. Observe the client's posture and gait standing, sitting, and walking. Observe client's overall hygiene and grooming. Note body and breath odor. Note obvious signs of illness, skin color, or breathing. Assess the client's attitude. Note the client's affect. Assess the appropriateness of the client's response. Listen for quantity of speech, quality, loudness, clarity, inflection. Listen for relevance and organization of thoughts. Document findings in the record using or electronic forms and check supplemented printed by narrative notes when appropriate. In relation to assessing the mental status of the patient, check the vital signs. Inquire if the client has any history of the following: pain or itching, presence and spread of lesions, bruises, abrasions, pigmented spots, previous experience with skin problems,
associated with clinical signs, family history, presence of problems in other family members, related systemic condition, use of medications, lotion, home, remedies, excessively dry or moist feel to the skin. Inspect skin color. Best assist under natural light and on areas not exposed to the sun. Inspect uniformity of the skin color. Assess edema if present. Measure the circumstance of the extremity with millimeter tape. May be useful for future comparison. Inspect, palpate and describe skin lesions. Apply gloves if lesions are open or draining. Palpate lesions to determine shape and texture. Lesions according to location, color, configuration, size, shape, type of structure. Use the millimeter ruler to measure lesions. If gloves were applied, remove and discard gloves. Perform hand hygiene. Observe and palpate skin moisture. Palpate skin temperature. Compare 2 feet and 2 hands using the back of your fingers. Note skin turgor by lifting and pinching the skin on extremity or on the sternum. Remove and discard gloves and perform hand hygiene. Or on the sternum. Remove and discard gloves and perform hand hygiene. Document findings in the client record using printed or electronic forms or checklists supplemented by narrative routes when appropriate. Draw location of skin lesions on body surface diagrams.
Sir, have you recently used to dye your hair or to curl or straighten your hair? So you did not curl or straighten or dye your hair?
Inspect the evenness of growth over the scalp. Inspect the hair thickness or thinness. Inspect hair texture and oiliness. Note presence of infection or infestation by parting the hair in several areas, checking behind the ears and along the hairline of the neck. Inspect amount of body hair. Document findings in the record using printed or electronic forms, a checklist supplemented by narrative notes when appropriate.
Sir, have you experienced any diabetes mellitus or record of any diabetes mellitus or vitamin?
Inspect fingernail, blade shape to determine its curvature and angle. Inspect fingernail and toenail texture. Inspect fingernail and toenail bed color. Inspect tissues surrounding nails. Perform blanch test of capillary. Refill. Press the nails between your thumb and index finger. Look for branching and return of pink color to nail bed. Perform on at least one nail on each hand and foot. Document findings in the client record using printed or electronic forms or checklists supplemented by narrative notes when appropriate. Inquire if the client has any history of the following: past problems with lumps or bumps, itching, scaling, or dandruff, history of lost consciousness, dizziness, seizures, headache, facial pain or injury, when, how, and any lumps occurred, length of time and to any other problems existed, any known cause of problem, associated symptoms, treatment, and recurrence. Inspect the skull for size, shape, and symmetry. Inspect the facial features. Inspect the eyes for edema or hollowness. Note for symmetry or facial movements. Ask the client to elevate the eyebrows, frown or lower the eyebrows, close the eyes tightly, puff the cheeks and smile, and show the teeth. Document findings in the client record using printed or electronic forms or checklists supplemented by narrative notes.